Good afternoon, everybody. Happy Wednesday. Beautiful day out there. Glad you're with us today. We've got 2 or 3 things to talk about today, and then, of course, we're going to take your questions. Number one, let's talk about the COVID numbers. You'll remember me saying that we had a little blip a few days ago at the end of last week. This week's numbers are continuing to decline. Yesterday we had 22 new cases. Monday it was 16. Sunday it was 9. So our case count is reducing again. With regard to hospital numbers, the hospital numbers, as you know, are regional numbers. They lag 2 days behind, but we've already gotten the numbers from today. So these numbers are Mondays. 245 people in the hospital in the region, either COVID positive or suspected positive. Of those 245 people, 66 of them are in the ICU. Of those people, 37 are on ventilators. That number is going down as well. And the 7-day average for new hospitalizations is 35 people, 34.7 to be exact. But 35 people. So those numbers are increasingly better. That's good. I will say that, we continue to have, and this is on the city's website, we continue to have some hot spots that are in, let's see, this is by neighborhood. So in Dutchtown, Gravois Park, the information by ward would be in the 20th ward, 25th ward. And we also have a little hot spot in the 21st ward, which is up near O'Fallon Park. So that's 14 days worth of data there. So our positivity rate in the city is, and this is a 14-day average rate ended today, is just under 4%, so that's a good positivity rate. We are meeting all of the metrics that we set quite a while ago for the region, and so we are beginning to look at what kind of mitigation procedures can we ease up on, and so we'll have more on that the next week or so. With regard to vaccinations, this is good news. In the city of St. Louis, 46,620 people have had their first vaccination. Of those people, a little over half of them have also had a second vaccination. And so those numbers are going to continue to go up and continue to help push the positivity down. Still do have to continue to wear your mask, have to continue social distancing, but the more people we get vaccinated, the better. We are getting more and more vaccine. I think that all of you know last weekend we had mass vaccination event both Saturday and Sunday at the America Center. We vaccinated just under 3,000 people. Tomorrow, Thursday and Friday, is in connection with the state of Missouri, the National Guard. We are having a mega vaccination event, it's called, at Forest Park Community College. You enter there off of Mackland, but it's essentially at Oakland and Mackland. You do need an appointment. Invitations for Thursday have been sent out. Invitations for open spots on Friday are going out. They may have gone out, but they're going out this afternoon. And so sign up. Tomorrow, Thursday and Friday's vaccination event are the Johnson & Johnson one-shot event, one-shot vaccination. We expect to vaccinate a lot of people over the next 2 days. And the good news is that Johnson & Johnson vaccine, you don't have to come back for a second shot. So we're very pleased to have that event Thursday and Friday. There'll probably be a line. Bring your patients with you, and come at your appointed time. 1, show up for your appointment, and 2, show up at the appointed time. Otherwise, we just get long, long, long lines if you decide to show up, you know, it's 8 in the morning, but your appointment's not till 10. That's just going to, you know, cause you to wait, unfortunately. So keep your appointment, show up at the appointed time. I hope we get thousands of people done tomorrow and Friday in the city of St. Louis. So we're excited about that. It's going to be tight there. It's a tight space. But big gym, big place to actually administer the vaccinations and wait. Not quite as big as America Center was. That's kind of the ideal, but America Center has a volleyball tournament, a big volleyball tournament starting tomorrow and this weekend, so that was not available. That's why we're at Forest Park Community College. So that is COVID and its vaccinations. Let me talk about something that we did this morning. This is kind of fun. So the second gentleman, Vice President Harris's husband, second gentleman Emhoff, was in St. Louis this morning. I was able to introduce him to a small group of people who were all there talking about Equal Pay Day. Today is Equal Pay Day. Now, what does that mean? We all know that in general, women make less than men in the same jobs. Women make 82 cents, this is the overall number, 82 cents on the dollar compared to men. For women of color, it's 66 cents on the dollar for men. And so today is Equal Pay Day. The second gentleman was in town in order to listen to a number of people. There was a woman there who owns an engineering company. There was a woman there who works for a construction company, a woman who's a home health care worker, and a woman representing Metro Trans organization. The second gentleman's staff was there, and so he's taking back this information to the White House. It was an honor to get to meet him and to introduce him and chat with him. Afterwards, I did have a few minutes to chat with him again, privately. And, you know, we were talking about how are things going with regard to vaccine and vaccination. And of course, he knew this, but I went through with him, well, when we started out a year ago on this pandemic, we had a huge shortage of PPE. We've been able to solve that. The next thing we had was a huge shortage of test kits. We've been able to solve that. The third thing we've had is a huge shortage of vaccine, and we're on the verge of solving that. So then our next shortage is going to be a shortage of vaccinators, because we're about to see a lot more vaccine coming our way. But we have to have the nurses and the doctors and the EMTs, the healthcare professionals, to get those shots into arms. And so we had an interesting discussion about that said the more locations that we can have the vaccine given in, the better. And of course, we were already calling on our Medical Reserve Corps, and that's generally retired doctors and nurses who are willing to give vaccinations. But so that's our next challenge, and it's not far away, where we will have a lot of vaccine and just have to figure out how to get it into arms. So, but we'll do that. I'm very encouraged that, you know, over 71,000 shots have been given in the city of St. Louis. As I mentioned earlier, 46,620 of them are individuals who have received their first shot, and almost half of them have also received their second shot. So that's good news. And we're anxious about to see tomorrow, Thursday and Friday, the big vaccination event at Forest Park Community College. And we are very appreciative that Forest Park Community College has really done a lot of work to help us organize for that event. It takes hundreds of people to put on an event of that size. So thank you to Forest Park Community College. Okay, I think those were all the topics I needed to cover. Do we have questions?
Couple questions. So on the topic of vaccinators, Shelley's question is, does the city currently have enough people trained to do the vaccination events, and how can one get involved as a volunteer?
So, Shelley, thank you. If you are a clinical professional, and you can give vaccinations, of course we want you, but if you're also someone who can just help us direct people, guide people, give them information, we need you as well. The way to do that is to email health@stlouis-mo.gov. Let me say that again. health@stlouis-mo.gov. You can also call our phone number, 657-1499. Either way, email, of course, is convenient if you have access to that.
Question from Debbie today. Are the vaccination events in the city still going through the state's tiered process, or have they been opened up to the general public yet?
We're still using the state's tiered process, but the state's tiered process has opened up, as you no doubt know. We are now vaccinating phase 1B, tier 3. So that is, tier 1 is healthcare workers, first responders, tier 2 is over 65, people with underlying health conditions. Tier 3 is teachers, child care workers, energy workers, that's military, government workers, that is tier 3. So we're now vaccinating all of those tiers. On Monday, I think it's the 29th, I believe that's Monday, the state is also opening it up to phase 2. Not phase 1B, but phase 2. Phase 2 is manufacturing jobs, transportation jobs, any number of jobs. So, and then on April the 9th, which is only another 10 or 11 days from that, on April the 9th, it's opening up to everybody. So we are on the verge of being open to everybody. Right now, we really are continuing to prioritize people over 65 or who have underlying health conditions or developmental disabilities or any of those situations, because they are the most vulnerable. But we're also vaccinating teachers, child care workers, government workers, etc. So that's where we are on that.
Question from Sarah today. With vaccine supply increasing, is it more likely that people living in the city of St. Louis will find local vaccine appointments?
Yes, it will be, sir. More likely that, perhaps we'll vaccinate as many as 5,000 people over the next 5,000 to 6,000 over the next couple of days. And then what we are anticipating, is that we'll continue to have many more opportunities for vaccinations. That's why we know that we're going to need more vaccinators and more volunteers.
So on the invites that the city sends out, Abby asked if you could remind folks that they need to sometimes look in the spam folder, the promotions folder, if they're using Gmail, because that's where some people's invitations have been going.
Thanks, Abby, for that. Yes, we talked about that, maybe it was last week, but if you're on the city's registration list, do check all of your folders. This comes from, what is the email address? Okay, we'll get that. We're not going to guess at it. We had it. It comes from the health department, but you probably do not have that address in your address book, and so it might shift it over to your spam. It's also, of course, coming out as a big email with lots and lots of people on it. So check your spam folders, your promotion folders, to see if you've gotten the invitation. We know that a lot of people get them because we get a lot of appointments, but we want to make sure that each of you, if you are getting an invitation, that you're able to take advantage of that.
Bonnie's question about the invite list is, and here's actually the email.
Okay. All right. Does it contact us?
Contact us.
Okay. So the email that the invitation is coming from is contact us at ochs.life. So it's kind of a strange email address, but contact us at ochs.life. And of course, that's what our database sends the email from. So check it out. If you see the email, there's a big health department logo right at the top of it, and I don't think you'll miss it. But look in your spam folders.
We had a couple of people, Bonnie, Mandy, write in and ask, how does one get off of the list if they've been vaccinated, or do they just need to ignore the email if they get one?
One, do ignore the email. Two, you can email us at the same email, health at stlouis-mo.gov, and tell us you want to get off the list. We're also, if we've emailed you several times, then it's unlikely that we're going to continue to email you if you haven't responded to. We know when people signed up on the list. There's a date stamp on it. And so we know that for people who have signed up more recently, they're probably more likely to still want to get the vaccine. And when we open it up to new groups, we know that as well. So.
We had two folks ask about their second shot. One got it at Carpenter's Hall, one got it at Omega. When should they be contacted? Who does the contacting? And should they just assume that they need to be back there 3 weeks after the fact?
Well, 4 weeks after the fact,
4 weeks.
Not 3 weeks. So at the Omega Center and at Carpenter's Hall, we gave the Moderna vaccine. Moderna is every 4 weeks. You get your second shot in 4 weeks. Pfizer, we were giving that early on, and we've already done all the Pfizer second doses. So that was a 3-week time period, but Moderna is 4 weeks. So for example, this Saturday, we're giving second shots of Moderna at the Omega Center, which is where you got it the first time. So you can show up at the Omega Center. You will get an invitation to sign up for a time at the Omega Center to get your second shots. But if I remember correctly, that day we did about 1,500 shots. So we'll have 1,500 second shots of Moderna to give this Saturday. So as you can see, we're doing Thursday, Friday, and Saturday this week. Now, at the Carpenter's Hall, which was the week after Omega, the first weekend for the Carpenter's Hall, you'll go back to the Carpenter's Hall also. You will get an email about it, but you can plan on 4 weeks from the day you got your last shot. And frankly, it's written on your card. Pull your card out and take a look at that, and it'll tell you what day to go back for your second shot.
You sort of touched on this earlier, but Gail's question, Mayor, was on the easing of restrictions. Does that include whether we will expand restaurant and bar hours or their available capacity?
It does. We don't know that answer yet, Gail, but it does. It's certainly something that we're thinking about.
CVS and Walgreens, we got a question from a Christian who asked about available shots at CVS and Walgreens and if they're going to be bringing more locations online.
We hope so. There are 2 Walgreens and 2 CVS right now that we're aware of that are giving vaccinations. They get a fairly limited supply, but you can get appointments there. I know several people who have gotten their shots there. You can also get appointments at Walmart. You can also get appointments at several of the independent pharmacies. So check with Walmart, CVS, and Walgreens for, that's a convenient place to get an appointment. I hope that we're able to have more of them come online. For them, it's a matter of getting the supply of the vaccine. But as I mentioned earlier, we are about to get a lot more vaccine. When I say we, it's not just we, it's the state of Missouri and the city of St. Louis, hospitals, everybody who's given vaccine. We're about to get a lot more of it over the next few weeks. And so they should have more as well.
That's all I got for questions today, Mayor.
That's all the questions? All right, well, great. Have a great day. It's a beautiful day out there today. Thanks for being with us, and we'll be back and talk with you again in a few days. Thanks, bye-bye.